Hi folks, Navid here again from Edinburgh Endodontist. Hope you're well. Today we are covering the second type of luxation injuries, the subluxation. If you want to recap on the aims, learning outcomes, etiology, please look at yesterday's clip. It comes under concussions. So, subluxation is a moderate injury, either stretching or crushing of the tooth supporting structures. As a result, a subluxated tooth will be a wee bit tender to touch, bit mobile, but with normal position, so there is no change in bite or occlusion. Because of the tearing of the PDL, you will see bleeding usually from the gingival crevice. As you can see in this close-up photograph, you can see how this tooth is presented. It's usually a bit wobbly and tender to touch. Radiographic examination should be unremarkable. Everything should look, normal and healthy. To manage subluxation of primary teeth, reassure the patient and parents, monitor the tooth. But if you think that it is extremely wobbly or if it's causing concern, what you can do is to remove it. I've seen some people trying to, do composite splinting and things like that. But generally speaking, if these teeth are extremely wobbly, it's because they are near exfoliation anyway. So it's better just to remove these primary teeth. In permanent teeth, again, reassure the patient and parents. Advise a 2-week soft diet and encourage normal brushing as soon as possible. Similar to concussions, really, discoloration within roughly 3 months from the impact is not unheard of. It could be transient, so reassure the patient and parents from the outset and in advance, and please do not start root canal treatment just because the tooth that has recently been traumatized has gone discolored. You really need 2 clear-cut signs of pulpal necrosis and infection before you go ahead with root canal treatment. Just monitor the pulpal status for these teeth for at least a year. If the tooth is very tender, you can apply a flexible splint for 2 weeks to help reduce the patient's symptoms. Only use 1 tooth on either side to make sure that it is as flexible as possible. And you can use a normal stainless steel ortho wire, 0.918 stainless steel. You can go to the member section of Dental Trauma UK to watch a clip on splinting, and please do that. We covered the splinting and the different types of splinting, if you remember, a couple of weeks ago when we discussed the root fractures. So you can, have a look at that as well if you haven't done so already. To monitor, obviously remove the splint in 2 weeks if you've placed it, and then when you do that, record your baseline sensibility test, and subsequently 3, 6, and 12 months, and annually review the pulpal status for 5 years. To sum up, for concussion, we talked that you just reassure the patient and monitor the tooth, and for subluxation, reassure the patient, and if the tooth is very tender, provide a flexible splint for 2 weeks. That's all for subluxation. Tomorrow we will go through extrusive luxation, so things are becoming more interesting. Stay safe, take care, and don't forget to visit Dental Trauma UK's website. And come back tomorrow for the next episode of subluxation injuries. Take care. Bye for now.